So this article highlights a very important point that a lot of people don't realize when it comes to health insurance, is that when a provider or a facility is termed as in-network, that means they have a pre-negotiated contract with the insurance company. So that means, if the insurance is going to be accepted there, let's say the insurance says, we're going to reimburse you, the hospital, $1,000 every time you do that procedure. Then the hospital has to determine, well, is that enough for us to pay our staff and to pay our overhead? Can we accept $1,000, or do they go back and negotiate, hey, we actually need $1,500, we need the insurance to pay out that. And if the insurance is like, well, we can't make money doing that, then they're not going to come to terms on a contract, and then that's going to be out of network and your benefits won't be good there. So what's happening here is this facility in Houston, this Memorial Hermann, they're basically saying, hey, we have a certain standard of care that we want to give our people. We have a certain amount of money that we need to pay our staff. So the insurance needs to reimburse this amount of money, or we just won't be able to be in business with you. And Blue Cross and Blue Shield of Texas, one of the largest insurers in the country, is sitting there saying, no, we're going to cut costs. We're only going to pay you X dollars for this when Hermann needs Y dollars just to stay afloat. And the insurance is playing hardball with them and saying, well, if you don't come to our terms, then we're just not going to have our people come to you anymore. So it's a real negotiating tactic, and they have a lot of say in this. And that's why it's really important to understand that if you have a health insurance that has a specific network, like an HMO or an EPO, a POS, something like that, you are liable for this to happen to your doctors and your hospitals at any time. And it's out of your control, and it's out of your doctor's control. It's all the bigwigs up there making the decisions. So what I recommend most people have, if you can afford it, get private insurance that does not become dictated by in-network, out-of-network. You can go wherever you want with it.